Welcome to the Menopause and Cancer podcast, where we speak with cancer patient survivors and incredible experts in their fields to help us find solutions to our symptoms and ideas to improve our health. My name is Danny Binnington, and today we want to be talking about low libido, zero libido. I have absolutely no desire, that kind of conversation, because we have so many people say to us that they have absolutely no desire to even think about embarking on sexuality, intimacy, but it really is important for them and their relationships, and they want to just have a little bit of that intimacy back in their lives. And it's often one of the symptoms that gets very much pushed to the bottom of all of the lists of symptoms, but we know it can have a huge impact on our lives and our relationships. I'm excited and delighted to be joined by Sam Evans, who is a sexual health educator and also the founder of Joe Divine, an adult sex toy company. Sam and I have hosted lots of workshops before with psychosexual therapists and other people in this industry, and Sam is amazing. And I hope Sam can really help us look at some strategies that we can all start doing and thinking about if we want to embark on maybe tapping back into becoming sexual beings again. It's a starting point. That's all I'm saying. Come and join me and Sam for this conversation. Sam, welcome back to the podcast. I'm excited to have you here today.
Thank you for inviting me back to talk about my favourite topic.
Sam, I need to tell everyone, I was in my garden, in the back of the garden, over 2 years ago when I had the idea of setting up the Menopause and Cancer podcast. And you were one of the first people I reached out to. You picked up the phone. You gave me some advice. You said, yes, go for it. I speak to cancer survivors all the time with your background as a nurse. And you were very encouraging. And you were one of the first one to come onto the podcast, actually, with Dr. Charlotte Gooding. So thank you for your continued support. And you then came to one of our parties we had. You know, it means so much to feel supported before you've done something that works. You know, it's very well people supporting you when you do something well, but when you have an idea and you then get people's support, it really meant a lot to me. So thank you, Sam.
But I also feel thank you so much for what you're doing, because there's a huge gap in healthcare, as you know, and I got so frustrated over the last 17 years at the lack of help that people have not, there's nothing out there for them. I have to say it has got a bit better, but we've still got a long way to go. But you created something that, a fantastic resource that I signpost people to all the time, because, and healthcare professionals, clinical nurse specialists, who don't seem to be aware of these things. And it's just great if they can share that then with their patients, because, it's just that additional bit of information and the support to be with other people who are going through what you're going through, because no one knows what you're going through apart from you, and then other people are going through it too. I can't know what you've been through or you're going through, but if you can actually get that support from somebody else and going, hey, I tried this worked for me, oh no, that wasn't so good. So thank you.
It's great. So Sam, you are a woman that wears many different hats. With your background as a nurse, you then became a sexual health educator. So is one of your amazing daughters. And I bought her book for my own daughters, actually.
Yeah,
so you're,
brilliant.
as a family, doing an amazing job at talking about pleasure, sexual health. And you also have a adult toy company called Joe Divine. And I want to talk about lots of your toys in a moment. Before we do so, I wanted to share with you and everyone else that I sometimes pop into our Facebook group. And in the Facebook group, I say a symptom, say hot flushes, and I say community tips. What has helped you? Share with our community. And we often get about 50 comments of people really advising others what's worked for them and what hasn't worked for them. And so in preparation for today, I said, low libido, any tips at all, share with our community. From audio porn to vibrators, what has helped you? And we had very poor messages as a result of my post, which is quite telling, isn't it? Most people actually said, yes, me too, 0. People said, following with great interest. I've been trying to access testosterone, but without much luck. I feel like this is such a big issue, but it gets pushed down the list of issues. People are saying, what libido? I seriously need advice. I've got 0 libido. And And that is really it. So there wasn't really anyone that was happily to share tips of what's worked with them. And so I'm thinking, is this just one of those symptoms where people think, I've got no idea where to start? What do you find,
Um,
Sam, in speaking to
I
people?
think so, especially low libido is something that pops up within the menopause community. Obviously, I advise a lot of people within the menopause community, but I think when it comes to cancer patients, it is way down the bottom of the list because there's so much else going on. And also, it's the easiest thing to let slip, your sex life and your sexual pleasure, in the myriad of everything else, all those symptoms that you're trying to deal with, and appointments and treatments and life, children, teens, adults, work, partners, everything. It's almost like it's too much, and it's just simpler to let it go. And actually enjoying good sexual health and pleasure is so important to so many people. Why can't you continue? If you had a good sex life before you had your cancer diagnosis and treatment, why can't you continue afterwards? And actually, we advise a lot of people at Joe's Divine, Paul and I work together with my husband. People say, actually, my sex life is better now because we're having to really think about things. We're trying new things. We've bought your lube. We've bought some of your toys. We're talking to each other. We're exploring new things. And that's actually made them more intimate because they're actually focusing on what works for them, because they've had to try different things to find out what works. That doesn't work for everybody, but a lot of people do tell us that because they've had to become a bit more creative with their sex life to enjoy the sexual pleasure that they had before they had cancer. But also, menopause, your sexual pleasure, well, as you get older, your sexual pleasure changes as well. What worked for you when you were 20 or 30 no longer works for you. And I know that now as a menopausal woman, but I know what works for me. So I know how I like to be touched and stimulated. And so does my husband. And, I think it's getting used to what was once there. I always say to people, yes, your sex life changes, but it's just going to be different rather than, it's not going to be very good at all. But the low libido, there's so much with low libido. It's the fact of, obviously, the physical impact of cancer treatment. So, your vaginal and genitourinary health, it's painful, it's sore, you might get recurrent infections, which is why it's so important, again, to use really good irritant-free lubes like Yes and Sutil. And also, we know that vaginal estrogen can really help, and we know that pretty much anybody can have vaginal estrogen after a cancer diagnosis. But also that decreased sexual sensation. So you might be struggling to reach your orgasm, with masturbation or mutual masturbation or oral sex or during the sex play that you have. So toys can really help with that. They offer a different sexual sensation, but also the mental side of it, what your body's gone through. If you had a mastectomy, a bilateral mastectomy, your body has changed. If you've had a hysterectomy, that part of your body is no longer part of your body. Some people are quite happy because the cancer's gone, but other people, they mourn the loss of these body parts. And also the breasts, obviously inherently connected to sexuality, and that's really difficult too for people to acknowledge that. So that mental impact affects your arousal, your desire, and your libido. And then let's add on top of that and looking after your kids, getting them to school, your teens who are going through puberty and exams, this is exam season, and, your partners as well, who, may be struggling with the fact that you've had a cancer diagnosis and treatment too, and they worry about you. And also you may have aging parents, and then your work. So it all sort of comes together, this whole impact of what actually can affect your libido. So, I always say to people, start small. I think start little steps.
And an integral part is, of course, also the lack of estrogen and the non-existence of hormone levels by so many. And so it's really, really complex. And I often think, where do we start with this, right? And I think if anyone is listening to this today is really thinking, what has changed for me? Is my libido totally gone? Like, sometimes I speak to women, and I know that from myself, I could go for weeks and weeks and weeks and not even had the thought, but the thought comes in because women say, and you and I have had workshops together with psychosexual therapists, and then when you think about it as a complexity, is it okay, you might not be missing it at the moment, but your relationship might be missing it. Your partner, if you are in a relationship, might be missing it. And so you might be thinking, gosh, we should be having more intimacy. I'm not craving it because I have no or zero sex drive, but I know it's really important for the relationship. So there is that aspect, isn't it? There is the aspect of just being close. And we know people stop cuddling and holding hands and kissing because they're worried it might lead on to something else. And if that something else might come with pain, of course, you don't want to go there. So there is all these complexities. And sometimes you just don't know where to start. And when you and I have spoken to psychosexual therapists, they actually say it doesn't start with the partner and the relationship, it starts with yourself, with you. How do you navigate that conversation? Like, how does it start with us?
Whenever I've given talks to cancer patients, I always say start small, start exploring your body on your own, this solo pleasure and exploration, because you need to find out what has changed for you. What are you struggling with? You know, when you masturbate, are you just struggling to reach climax, or is that actually just not, oh, that's not really doing very much for me at all? Or, you know, sort of, you know, you've used a toy and it's sore, you know, and you're thinking, well, I actually don't really want to go there. And I just think, I always say to people, get yourself a simple little bullet style toy and take it off into the bath or the shower, and have a little bit of a relaxing time. You know, they're so inexpensive. They're really little. You know, there's nothing non-threatening about these toys. And I just think they're a really simple way to sort of kickstart those nerves and those sexual sensations that you no longer can feel. And you may be somebody who's never used a sex toy before, which is why I always say to people, always start small. You know, my heart sinks when I hear that healthcare professors, oh, go and buy yourself a vibrator online. And it's like, there are so many of them. And some people do not want to go onto a great big website that's got thousands of products, which is why we have the health brochure, because it's a curated range. And I am aware of the fact that some people have never used a sex toy, and then you're sort of suddenly told, well, you're clinical nurse specialist, grab yourself a vibrator or a dildo. And it is kind of like, where do I start? So I always say to people, start with yourself, explore your own body, you know, stroke yourself, sort of the sensation of touch. You know, it's sort of just close your eyes, because that heightens all your senses as well. And that's the same with partnered sex too, blindfolded sex, because this heightens all your senses of touch, taste, smell, hearing. And that actually is a really good way to say, well, actually, I've got some sensation there, and actually that feels quite nice when I touch it. But I always say with a simple little bullet vibrator or a little clitoral toy of some sort. I mean, this is the Joe Divine Immi, which is our most popular toy, because it's our own toy, but it's got a little silicone cover, and I just pulled the bullet out of it. It's a 2-in-1 toy, you know, and that's great for both internal and external play too. And I think I just feel like saying to people, focus on that sensation. And you mentioned audio porn. Again, that's something that a lot of people aren't aware of. You can listen to somebody narrating a story, and that actually can helpfully create some fantasies in your head, or kickstart that sort of those feelings that you once had, or feelings that you've never had before and they're new to you. I think that is a really, really good way. But I always say to people, do explore on your own first. If you're worried about introducing even a simple bullet vibrator into your relationship with your partner, and I always try to reassure people, I'm going to, the vast majority of partners would be quite happy you using a simple sex toy, because they want you to enjoy pleasure, but obviously they want to connect with you as well. It's not like people are desperately wanting to get back to sex, because a lot of partners are really worried about hurting their partner. And then that impacts upon their sexual function. You know, for men, it can impact upon erectile function. Obviously, for female partners, they might think, well, you know, I don't want to touch her. I'm really worried. What if I do this? Is that going to hurt? And, you know, and then that impacts upon their libido. So, you know, so it can be quite difficult sometimes. This is why the communication is so important. But I always say to people, just enjoy a little bit of self-pleasure for yourself to discover what has changed and what sensations you can enjoy. And you might find, you know, you've got a simple bullet vibrator. I mean, the sonic wave toys are really good. They use this different sensations, sexual stimulation. You don't move them, you pop them over your clitoris, leave them in place, lie back, relax, enjoy. It sends the sensations through that clitoral tissue. And that actually is a really good way of kind of warming up for sex play. It'll be on your own or with a partner, because it promotes the blood flows to the tissue of the vulva and the vagina. That engorges those tissues. It helps promote your natural lubrication. But obviously using a good lube in addition to that can help. And those sexual sensations as well. And you'll think, oh, actually, and it's firing off all those nerves and, sending those messages through your body for you to remember again, actually, it actually feels really, really nice. And even if you're not in the mood, I kind of think sometimes just take your toy off into the bath and you might want to play with it, or just get yourself a little bit of me time and just spend some time with yourself, because I think that is really important.
Because if we don't have any libido, like if people say, I've got zero sex drive, zero libido, zero desire to even embark on any intimacy, whether that's with myself or with a partner, but you want to get that intimacy back. That's the problem, isn't it? There is something you want. And so you've got to sort of do something. You can't just sit and wait until you suddenly drive the car and think, oh, I'm really horny, I could have sex now. Because there's too much of a disconnect, isn't it? This is too much of an expectation. So we've got to become active somehow. And so by bringing, like you say, maybe audio porn or stories, or tuning into other podcasts that just talk about sexuality and sex drive, could be a really, by bringing it into your life, by bringing the conversation into the life, by stories or pictures or whatever it is, or like you say, by exploring that touch, is a really good starting point. We've just got to do something to get ourselves onto the next stage. And what I learned in preparing a little bit for today's conversation is that actually many women have an all right sex life, but it's not hugely fulfilling. And so then when cancer comes along and changes, it doesn't take a lot of changes or explosions, as some experts call it, to really sort of disrupt how the system works between us and our partners. And so often this exploring really is uncomfortable, because we're exploring things we might have never explored before, like self-touch, like using sex toys, for example. So it feels like it's a lot to ask, isn't it? We're suddenly maybe middle-aged or however old we are, or even older, and we're suddenly asked to really look at our sexuality, maybe for the first time in our life. It can feel quite uncomfortable.
No, I agree with you. And I've said, some people are quite happy to let their sex life go, and if, and that's fine. And if their partner's happy with it, saying nobody should ever be forced into doing anything they don't want to do. But I do think that some people find it's a bit of an awakening. As I said, some people have told us, actually, our sex life has got better because we try different things. We've taken the focus off, swinging from the chandeliers and all singing and all dancing penetrative sex. We actually do so many different things. Actually, my partner's been on a massage course. That can connect people. But again, it's always to do with people's shame and embarrassment about talking about sex. And you say a lot of people have a sex life that's a bit meh. And so, they're not in them with everything that they're going on with. They don't want to put the time or the effort into it. But I do think if you do want to get back, sort of some semblance of a relationship, and remember, sexual pleasure is so important for you. It's good sexual health and pleasure for your physical well-being. It keeps everything happy and healthy, your whole genitourinary system, but also fires off all those feel-good endorphins, having an orgasm or just enjoying sexual pleasure, stimulation, it can reduce your stress, your blood pressure, help you sleep, make you look younger, apparently, boost your immunity, and it helps with connection with a partner too. But also, so I agree, it is really hard, which is why I say to people, right, get yourself a nice tube of lube and a simple bullet vibrator. It's a really small step, small toys, good lubricant, and it's just a starting point. It's not threatening. I'm not telling you to go and buy the biggest dildo or sex toy in the sex toy shop, and actually when people do this, oh gosh, I'd never thought about this. And some people have actually used sex toys and actually said, oh, I never really thought that. Yeah, I should go back to using my sex toys, and actually some patients are being advised to use sex toys, which is absolutely brilliant. Obviously, our health brochure is given out in the NHS with the sex toys in it. But I say to these people, if you, as you said, it's not going to come back if you just sit there and do nothing. And the longer you leave it, like anything, you know, whether you've been through cancer treatment or not, and I know what it's like, we've had dry periods, you know, during our relationship of 33 years. And it's really hard sometimes to get back into the sack, literally. But you've got to start somewhere. You know, we've started by kissing and cuddling. And gosh, we actually haven't had a kiss for 2 days, or, you know, but actually when we've not actually had sex, and we may not go on and have penetrative sex, but we may just give each other an orgasm. And I think also we have to change that mindset that sex is so much more than penetration, and not everybody has penetrative sex. And also, you know, it's about playing together. You know, it's about giving each other a nice massage or something. That can be just the starting connection as well.
I learned that, Sam, actually. Sorry to interrupt you, but otherwise I'll forget. I learned that in your daughter's book. And she has a big chapter in there, Sex is More Than PIV. And when I first read it, I didn't even know what it was. And so I thought, oh, what is that? And so my daughters were rolling their eyes, obviously. But the book is on their bookshelf. And so PIV, penis-in-vagina sex. Yeah. And, you know, up until then, for me, and I was, you know, in my 30s when I learned that, sex was very much penis in vagina sex. Really, that was sort of the picture and the narrative I also grew up with. And I learned so much from reading your daughter's book and your health brochures. And so I was quite intrigued. And I want to talk about lube in a moment again, but I was intrigued that not all of the vibrators or sex toys that you have go into the vagina. And especially for some of our gynecological cancer patients, there might be tools to help them keep their vagina open and working. So that's sort of like a medical treatment almost. But some of your toys don't go inside the vagina. And I thought that was very interesting.
No, yeah. And the vast majority of people with a clitoris will orgasm through clitoral stimulation. So this whole penetrative sex, you know, this is why a lot of women don't have an orgasm, because they're not getting sufficient clitoral stimulation. And so, yeah, and actually, yeah, women, you know, with gynecological cancers are given dilators to stretch the tissues of the vagina, which can often shorten, certainly if they've had a hysterectomy, if they've had pelvic radiotherapy, if they've had surgery. But also some of our toys, some of the people would prefer to use a vibrator or a dildo instead of the medical dilators, which are very, very clinical. We have the nice silicone ones, but they're not available on prescription. But I always say to you, so I always talk about clitoral stimulations, this external stimulation. So the
Show me what you've got.
So, yeah. Oh, gosh. So as I said, you know, bullets, that's your cheapest, most expensive starting point, you know, sonic wave toys. So these don't vibrate. These basically have this. There's a Lalo Sona 2. It's our most popular toy because I showed it on the Davina McCall program, but it is really effective. So what you do, this is your clitoris. This is what you see on the outside. That's the clitoral sort of nub that you see. These bulbs sit either side of your vagina. Pop it over the toy over your clitoris with a bit of water-based lube to get a seal. And what it does, it sends those sonic wave sensations through these clitoral bulbs which sit around your vagina, and it slowly builds up. And this builds up into a very, very slow climax or orgasm. As I said, it promotes, any vibrator will promote the blood flow to the tissue of the vulva and vagina. That, you know, engorges them, that helps with arousal, sensation, your desire, because it feels pleasurable. You know, and these start on really low levels. So if you are feeling a bit sensitive, some people have hypersensitivity, you can start really low. And also if you are struggling with decreased sensation, then you can turn it up. The only thing is you can't use these during penetrative sex because it gets knocked off. But obviously you can use it as part of your sex play to kind of get you warmed up for sex, or your partner can use it on you. Some are app controlled if your partner wants to control them. And this is a fun little one. We've got a range of these that we're just adding to the website. They're called the Rose Buddies, and they have so many different sensations. They have different actions, and so it vibrates, but also, and it'll sound, it's like the sensation, it's like a partner's tongue. So you can mimic oral sex, but there's some that look like a finger. There's some that sort of have the pulsations like the sonic wave toys. I'm just going to
try and explain those for anyone listening and not watching our conversation. So both of these look like handheld silicone
Yeah.
nicely shaped toys. And this one almost looks a bit like a rose
Yeah.
from the front. So it's basically just a round sort of shape with a moving bit on the inside. Like you said, it
Yeah.
looks a bit like a tongue maybe. So you
Yeah.
could stimulate your clitoris that way. And the other one that you showed also is a handheld piece with a little hole. And so there is no sort of vibration. It's sonic pulsations. Is that what you
Yeah.
explained? So
Yeah.
that's,
So basically, it sort of teases and caresses the clitoral tissue. It's sort of, there's a little membrane down inside that hole, and it's going up and down. And basically, it is, there are, does it vibrate? I don't even know if it does, but it's gently teasing that clitoral tissue. So it's sort of like not sucking on it, and then it sends those sensations through. And obviously with vibrations as well, you've got different types of vibrations. You've got pulsation patterns, you've got different speeds. You know, there are toys. I mean, I showed you the one with a little tongue in it. There's one with a ball bearing in it that sort of mimics oral sex too. You know, there's one again that sort of kind of sucks and vibrates. So it's actually about finding things that offer different sexual sensation. But again, you just saw me show that. They're called rose buddies. They don't look like a sex toy. So anybody who's really worried about buying something, you know, there are toys that just simply do not look like sex toys if you did happen to leave them lying around. There are simple pebble ones. I didn't bring it up, but it sort of sits in the palm of your hand, and it's so cute. And, you know, again, it just looks like a beautiful product that nobody would really know what it was. So, and also remember, some of these toys can also be used on partners. Obviously, if your partner's got a clitoris, but also your partner with a penis up and down the shaft of the penis, on the head of the penis, on testicles, you know, on nipples. You know, it's actually about having a bit of fun with these toys. We have people saying, yeah, we've been using the little bullet, you know, on our nipples. And it's sort of like, it's offering different sexual sensations, you know, that actually can, that make you laugh. I think that's the most important thing, that make you relax, because that also then helps with your arousal and your desire. Your body relaxes, you know. And I think that we're not being serious because, you know, with the medical dilators, people have been through treatment for so long, and they just feel like their bodies have been medicalized, and we're just normalizing sex and saying, well, actually, you know, you've been through this, or you're still going through it, and actually these are a bit of fun. I always, whenever I do a talk to healthcare professionals, I always say I'm the light entertainment, because that's how I want to come across, as this is the fun bit that you can actually recommend to your patients, for them to realize that you're a human as a nurse or a doctor, and actually you're telling your patient, hey, you can still enjoy pleasurable sex. So,
and so what is the role of lube when we talk about these sex toys? I know, you know, people have called you the lube queen before, Sam. You know, you've been talking about lube for a long time, way longer than most people that I've spoken to. Talk to me about lubes.
Okay, so basically you have your own natural lubrication, and that can get impacted upon obviously by cancer treatments, you know, the impacts of chemotherapy, radiotherapy, going through the menopause, but also your natural lubrication is impacted upon by stress, anxiety, where you are in your menstrual cycle, menopause, post-childbirth. If you're breastfeeding, that impacts upon your lubrication, and medication. This time of year, people take antihistamines. Antihistamines dry up mucosal secretions. So that's your eyes, your nose, and, you know, but it also dries up your vaginal lubrication too. And so vaginal dryness is a big problem for a lot of people. And just because you're dry doesn't mean to say that you don't feel aroused. You know, I can often feel dry, but I actually really, really want to have sex. So popping a bit of lube on, like the Sutil Luxe water-based lube, just gets me started. And obviously with toys as well, it can make toys feel far more pleasurable to use. But there are rules with lubes. So water-based lubes are the most common lubes that are out there, and they are the closest to your own body's natural lubrication. The problem is the vast majority of water-based lubes contain irritating ingredients. We now know this because we have research, you know. So the products that, you know, that are still being recommended by healthcare professionals, that are still on some cancer websites, which drive me potty, you know, and are out there on the high street. We've got shelves heaving with them. I would say to people, be an ingredients detective, check those ingredients. So, you know, glycerin, glycols, parabens, dyes, perfume, alcohol, glitter, sorbitol, CBD. There are so many ingredients in some of these lubricants, and what they do is they impact upon the tissues of the vulva and the vagina, and they actually can cause irritation and itching and stinging. And glycerin in particular, and propylene glycol, can cause thrush. because it creates a sugary environment inside the vagina, and that encourages thrush to thrive. And when you have no estrogen, you're more prone to infections like thrush and bacterial vaginosis. That's a fishy smelling discharge, because you need that estrogen to keep everything balanced inside your vagina. So then you are more prone. So it's really important that you do avoid them. And also, if somebody is diabetic as well, often people, you're more likely to be prone to thrush, again to do with the sugar and your control of your glucose, your sugar levels. So again, it's really important that they checking. I mean, everybody should be checking ingredients, because why would you want to put something in your vagina or inside your anus that isn't good for you? And actually I always say to people, if you think about what you eat and what you put on your skin, and people very much think about that, certainly once they've been through a cancer diagnosis and treatment, think about what you put inside your vagina or on your vulva. So water-based lubes, oil-based lubes. I'm not talking about your cooking oils out of your kitchen cupboard, or I'm not a huge fan of coconut oil. I know some people love it. I always say, make sure it's 100% pure, it's organic, it's in a tube, not a pot, so you're not sort of contaminating the pot when you dip your fingers in it, and it's ethically farmed, so not by monkeys on chains. But things like, those baby oil and bio oil was something I heard, and anything with petroleum jelly, anything that's got mineral oil in it, none of this stuff was designed for intimate use. So again, that will disrupt the microbiome or your friendly bacteria inside your vagina. It can block pores too. So the oil-based lubricants, great. That's what saved my intimate health and our sex life in my 20s and 30s, which had been destroyed by using the well-known lubricants, which caused lots of infections. And which I discovered when we set up our company. So, and also you can use the water and an oil-based lube together. You put the oil on first and the water on top. It creates a double glide effect. And then you've got, we also, there's the lubricants, the Sutil, Lux and Rich, the 2 water-based lubes we sell as well. And then there are silicone lubricants. Silicone lubricants are really slippy, but I don't generally recommend them for people, post-cancer treatment in menopause, because they're not going to nourish the tissues of the vulva and vagina. You want something that's going to nourish and hydrate and moisturize like your skincare products do. And it just sits on top of the skin. And also silicone lubes really shouldn't be used with silicone sex toys. It will damage the toy because it kind of causes sort of an abrasion. You can't see them, but they're micro abrasions. And then that stops the toy from being, hygienic. So, I always say to people, do your research. It always shocks me when I hear that, I hear nurses telling patients to use Vaseline and olive oil and baby oil and the well-known, lubes that are out there. And it's kind of like, because they aren't knowledgeable. And also, as I said, on the cancer websites, I've seen that some of them are, why? Because it's on prescription, therefore it must be fine. But actually, there's some stuff on prescription that is not good. They do contain irritating ingredients. So I always say, be an ingredients detective and sort of get your get your warning bell out and say, pick it up and read it and go, well, actually, no, it contains that. Maybe I should avoid it. So, but lube can make such a difference. It could be, it can get you going. I say to people, pop a bit of lube on before you start playing together. That's what me and my husband do. No lube, no sex. And then the Sutil's great because it interacts with your own body's natural lubrication. That makes you feel more lubricated, so you feel wetter. It's very natural. And a lubricant should feel natural, not intrusive, which is why the Yes and the Sutil are such good products. But just be aware, there are so many products out there, as you are aware of, targeting our menopausal vaginas. Stick menopause on the label. We can charge 3 times the price. It doesn't matter what the ingredients are. So do your research, because that's really, really important.
Suzanne, what strikes me every time I talk to you is that you talk about pleasure, intimacy, sex toys, lube with such ease. And I know you've practiced for years. And as a nurse, you might have always been a little bit more open in asking your patients. We know a lot of nurses. You weren't. Oh, were you not? Because we know from a lot of nurses that don't talk to their patients about sexual health.
It's not part of nurse training. It still isn't. It's not part of med school training. It still isn't. And I'd love to talk to medical and nursing students. No, you used to have a thing. It was the activities of daily living. There were 12 of them, washing, dressing, eating. There were various things, mobility, sexual health. And you literally would just ignore it. Nobody would ask anybody. I never had a conversation with any patients about their sexual health or pleasure. And I look back now and think, oh my God, and you sort of realise there were situations on wards and you think, oh, that actually was a problem. I was a renal nurse, and I even did a project on the sexuality of the renal patient, because having renal failure does impact upon your sexual function. And I remember presenting this project to a doctor and they weren't interested. And I remember thinking, oh, and then I left and worked somewhere else. And then I kind of sort of forgot about it. I had my own issues. I carried on using those lubes for years, and it caused all the infections for 20 years. Not one doctor asked me about my sex life, even what was I washing my knickers with, and also then I developed vaginismus, and the pelvic floor muscles tightened. It made sex painful and not possible. Got a diagnosis at 30, never heard of it, trained as a nurse. And it wasn't for another 10 years after that diagnosis did we actually discover, actually, it's the lubes and the ingredients in these lubes we've been using for years that have actually caused all these problems. So, no, I would be honest. And honestly, sometimes some of the nurses are some of the worst. They're not going to talk about this stuff. They don't think it's appropriate. They're too embarrassed. My own GP calls sex contact. Drives me potty, but he doesn't get away with me, bless him. But it's actually what I try to do with my talks to healthcare professionals is to make them feel comfortable and confident about talking about these products. And go, well, hey, look, these are all the products that are in the health brochure, and this is how you use this one. But you can give out a health brochure. You can show them the IMI, because they all have a little IMI to show, and they have the lubes, and they can give, and a lot of them give out lube samples, and then they can say, actually, here's the brochure, and have a look at this website. Contact Sam. Have a look at her Instagram, because it almost takes the onus off them a bit as well, because they're so busy, aren't they? You've got, and I think that's why I think sometimes when cancer and sex and cancer isn't discussed, because there's so much else to be giving out. I remember somebody who told me, it was Sarah Jane Myatt, she's absolutely brilliant, who shared her experience of having cancer and how she was misgendered and, so many things that weren't right. But she actually said, I got handed this big bag of leaflets, to go through. Where do you, and so, there wasn't anything about sex in there, but, you've got all this information to deal with. So yeah, but it is slowly getting better. But there's still going to be healthcare professionals and doctors out there who will never ever talk about sex. And I get frustrated because I say, if you're actually treating people and your treatments and surgical interventions impact upon their sexual function and pleasure, then you should be able to talk about it. But I come across gynecologists and oncologists and clinical nurse specialists, and they don't. But I think sometimes it's because it's not part of training, and we do need to make it part of training. I don't know how, but even if they just had one session of me waving sex toys around and saying, hey, you could use this. And also a lot of them, when I've talked to them, said, actually, it's helped my sex life too, because I've started using your lube. So, it's a win-win situation. You're helping everybody.
I feel like there is it's like a bridge. There is you with that openness to talk about it, the openness to share your story, but all the knowledge you have about, the benefits of lubes and different sex toys. And then there are so many of us listening, and myself included, who think, oh my gosh, I'd love to be as, open and outspoken as Sam is. And there seems to be this bridge, but it's quite nice to know that you can embark on this journey and open it up. And in yoga, we often say, you step on the mat without an expectation, a bit like in meditation. The expectation isn't to sit there and not have anything in your head. The expectation of meditation is, or in some forms of meditation, is just to notice what comes in and out of your brain. And just to notice that in a non-judgmental way. And I think we have to be really non-judgmental and compassionate when we want to change our sexuality or reignite a little bit of that lack of libido. Because when you're embarking on anything like that, and you said, it needs to be a bit fun, I think that's a great expectation. But then when it isn't fun, you're like, oh gosh, now I've sort of not achieved. And so maybe it's just doing something is the best sort of expectation to have, whether that's going to be a good thing you're doing, a pleasurable thing, whether that's going to be fun or stimulating, as long as you're sort of doing something towards moving back into having a connection in whichever way, then maybe that's a really good first step. Or talking about it more with your friends and just using the words, because I feel there's often such a block, isn't it, for us, left, right and center, and then we feel so isolated because we're not sort of breaking through those blocks in a way.
No, and as you say, trying things, and if it doesn't work, then try something else. I always say to people, as long as you don't fall off the bed and break your leg, it's just about trying things, which is why I remember speaking to some, it was Overcome, and it was the ovarian cancer patients. It was one of the first sort of talks I'd done for a charity. And there were two women there, and they said, hadn't even thought about getting myself a simple bullet vibrator. And they're going, oh, I've got to do that. And I think she messaged me then, and she said, oh my God, actually, it's what has kick-started the relationship and my pleasure, because but she said nobody had suggested it to me. So I think sometimes, healthcare professionals are a bit wary of suggesting stuff to patients. They feel like they don't want to embarrass them, or they might feel uncomfortable. But sometimes you can get an idea with your patient, are they interested? If you actually just include it in a conversation with your patient. Oh, and actually, so how are things? How's your sex life? How does it feel? Have you got vaginal dryness? The problem is too many healthcare professionals ask closed questions, which mean yes or no. Whereas if you actually do an open-ended question and saying, how is your sex life? What about vaginal dryness? How is sensation? But, just throw it out there in the midst of other stuff. Because often I know a lot of healthcare professionals I work with for all patients say it's the hand on the door at the end of the consultation, and they'll turn around and go, and by the way, doc or nurse, oh, I've got problems with my erectile dysfunction, or, oh, I've had a few infections. They've just suddenly brought it up and your consultation's over. And I think that's quite different. So I don't think that patients should be bringing it up unless they want to, unless they feel comfortable. It should be a compulsory part of treatment. And whether or not you give out our health brochures, a lot of people do, and they'll say, I had one woman, she'd had it for about 18 months and she'd kept it in a drawer, and then she phoned me. I said, that's great. We have people who ripped out our adverts from magazines 5-7 years ago. They hold on to things. And it may have been that for that woman, she was ready 18 months post-treatment to think, right, I need to do something. And we had a really good chat. And I was really thrilled because it was like, well, you actually held on to that and you kept that. And at the time it wasn't ready. You weren't ready for it, but now you are. And I think if you make people aware that, this Josie Vine is available, this function, this service is available, this website's available, this person on the end of the phone is available, then people will come to that when they are ready. And comfortable. And I think that is, the important thing to sort of to tell patients, you haven't got to be having sex, 3 weeks after you've finished your treatment. It's kind of like, and as we've said, sex is so much more than penetration anyway. It's whatever makes that connection in whatever way. And it is a combination of stuff. You've talked about yoga and meditation, but I've talked about audio porn, and we talk about watching porn and reading porn, but also there are so many, there's sort of the conscious sexuality community, and there's so much sort of I can't remember the word, somatic sex, where you're getting in connection with your body. There are so many different things that you can explore now when you're comfortable that actually can sort of kickstart those sensations and you connecting to your body, or reconnecting if your body, you feel like it's changed, and you're a changed person, and your body may have changed physically, but also mentally, you're in a different place now. So there are lots of people out there doing some really, really good. It's always important you go to a trained practitioner, and I'm always happy to signpost people to them. But and for us, from a health point of view, I was pelvic health physiotherapy and psychosexual therapy, as you've mentioned. It's not just about, I'll buy a tube of lube. That might work for somebody, but it could be, well, that's in combination with trying other things and seeking other professional advice as well. So, it's an holistic approach, but that's what healthcare should be anyway. That's really important.
And I love that you bring all of these different facets into this conversation, because, when people get diagnosed with cancer, you have no idea what's lying ahead of you. Then menopause muddles in, and sometimes people get, very frustrated, and it's quite depressing when many years after your initial cancer diagnosis, you're still impacted by how your treatment has affected you. And then it affects not just you, it affects your relationships, and it can be so disheartening. And what I love about what you've just said is when the time is right. So if anyone is listening to this conversation, they're thinking, yeah, actually, I want to be a sexual human being again, or I want to have that part of intimacy back in my life, then this is a good time for someone to think, maybe I'll start with a bullet vibrator, or maybe I'll start with some audio porn and buying some lube, or maybe I do like, you suggest, and maybe see a psychosexual therapist, because whatever works for one person won't work for the other. But I hope this conversation has sort of ignited a little bit of interest and curiosity in people. Should it be the right time for them to start exploring more? And, thank you for teaching us that we can speak so openly about these things, Sam. Like, I think to me, that is always so reassuring and so exciting to see that it's possible to talk about sexual health and sexuality and pleasure that openly. And you are really amazing at that. So thank you, Sam. It's been great to chat to you.
Thank you. Thank you so much.
And we're going to, can I link to the bullet vibrator and everything you've mentioned in the show notes?
No,
Is
definitely.
that okay?
Yeah,
Can you send me links?
So. Yeah, I will do. And
Lovely, thank you.
Yeah, and we'll do a discount code as well.
So
yes, well,
that would be very nice.
I'll come up with it all.
Oh, thank you. That would be nice. And actually, one of the comments we did have on that Facebook post, I'm just looking back at it, was from a lovely lady called Samantha, who said bullet vibrators are a game changer.
Yeah.
So it's one thing that someone does echo. So if it works for Samantha, it might work for someone else.
Yeah, and it's such an inexpensive product to buy, and make sure you buy a good one. But yeah, I just think it's something, I always sort of, Liz Oridan came up with a sex bag, which I thought was great, keeping all your little fun
like
things and your dilators and your lubes. And actually, I've written about it on the website. I pinched her idea, but I called it an intimacy bag, and I think it's a great idea. And get yourself a pretty little bag, zip bag, and just pop all your goodies in your little bag, and then you've got it all together when you want to actually enjoy some pleasure on your own or with a partner. So, but I thought it was a great idea of Liz's actually having this sex bag. I thought really good.
Love it. Get stocking up, ladies and gents. Thank you. Bye, Sam.
Thank you. Bye.
Okay, I have no idea how you're feeling, because I know for so many people, when we talk about sex toys and lubes, they're like, oh, but I still can't be bothered. And I know sex toys and lubes aren't going to really change your desire and bring your libido back. And I know it's also quite cringy to sort of bring sex toys into relationships when you maybe haven't used them before in your relationships. And so I think there are so many elements to this conversation, and it's a really complex symptom, isn't it, to sort of tackle, to treat. I am hoping that this conversation with Sam today opened your thinking to the conversation. That's all I think I was really hoping for this conversation to do, and for you to walk away from this thinking, do I want to do something about it? Is it impacting my life, my relationship, my partner? And maybe I can just go and look on maybe Sam's website and see what these sex toys look like. If you've been listening to the audio recording of this podcast rather than on YouTube, then you haven't seen the little sex toys that Sam has shown, and maybe they're new to you. Maybe you think, actually, I'm going to just try. I'm going to get myself a lube, and I'm just going to see if that makes a difference. Or maybe you think there is absolutely no way, I don't think it's going to work for me. And then maybe you leave it, and then that conversation will open another way of thinking for you. It might do something else for you. I think if you feel it's important to address low libido, lack of desire, just bring the conversation more into your life. Find a podcast, someone else's podcast, for example, where all they talk about is intimacy, sex, pleasure, and bring those conversations into your life. I think that is always the best starting point. And with that, I love you and leave you. And I hope you enjoy just browsing the World Wide Web and Sam's website of what else is out there that you maybe haven't tried so far.